Right.
No, that should work. Well, hi everyone. What a pleasure it is to be here on what is truly a global phenomenon. It's fantastic and an absolute honor to be among giants, people that I grew up with and grew up watching and listening to and seeing their names and things, and it's wildly exciting to be part of that. Abe Fingerhut, of course, has been, if you like, the grandfather of teaching us all how to do our job properly and with adequate probity. And from a BJS point of view, Derek Alderson was very much the grandfather of doing that. And we have, over the last 16 years, done a number of teaching programs on that. And that has led to the initiation of the BJS Academy. So these slides are from that, and they're fairly straightforward. So I have about, just pass on, about 15 slides to work you through nice and gently. So what is peer review? I view those two words as a curious juxtaposition of two visually descriptive words. They're quite interesting, aren't they? To peer means to look at something purposefully, to look at it actively. It implies something critical, to peer over a hedge at something critically in the neighbor's garden, for example. It also refers, of course, to a group of descriptively homogenous individuals, those who are based in the same profession as we are in this case, or the same age, and you refer to children's peer group. There is one other peer, of course, but that exists only in those countries which have peerage, like in England, where they have lords and ladies and such things, that they're also peers. But in this case, we're talking about looking purposefully, critically, and by someone who is a descriptively homogenous individual inside your own profession. That is, that they are qualified to do so. That is, that they are in a good position to be able to critically appraise what it is that you have submitted to a journal. And if we start thinking about what are the requirements of peer review, in essence, it's to validate the originality, the relevance, the novelty, the appropriateness, the generalizability. And I like to think of how impactful, this is not impact factor, this is how impactful is the article or the body of work that is submitted to the journal in terms of actually changing practice, casting a different light on practice, or indeed casting a shadow on practice in terms of the way we do things in surgery. Blindedness is an interesting thing. Most of our journals operate under a facility where the referee is knows who the authors are, but the referee remains blind. So that's single blindedness. Double-blinded is some journals where both the authors are blinded to the referee, and in addition, the referees remain blind to both. Transparent, which is perhaps one of the more interesting modern phenomena, is where the referee reports are also published with the published work, but they're published without names. And then finally, of course, is open, and I am not familiar with any surgical journal that does this as yet, where referees are named in addition to the authors when the manuscripts are published, in order that everyone has a very clear idea of who it is, and in addition, you publish as a journal the referee report too. So there are the options for blindedness. Most surgical journals are either single or double at this time. Some of the responsibilities of referees. Obviously, promptness. In an ideal world, I think a referee report should be back within a 2-week period. Advice to those of you who have yet to be referees or who are early career referees, please think about it like this. If you get something into your in-tray and you accept to do so, we as editors are now heavily reliant upon that. We're very grateful for it. But in particular, it's the authors. It's the authors who you're working for, not the journal. And the authors would like that back in a timely fashion. Imagine yourself to be the person submitting an article. If you wait for more than a week, you're already getting into a time period where it becomes at the end of your in-tray. It becomes at the bottom of your email list. It becomes a chore. My advice is only to accept something that you're able to do in a timely fashion, and if at all possible, open the paper at that time, print it if necessary, and mull it over the next day or two and try to get that referee report back within a week. If you need more than that, no problem, 2 weeks is fine. Anything outside 2 weeks, personally, I think is not really acceptable in a modern world, and it's certainly not what I would want for our authors. So we do our level best to get a first report back at BJS within a 2-week period, 14 days. Obviously, we want something which is meaningful for the authors. It's writing a cursory 1 or 2 lines saying this is great work, well done, it should be published. It doesn't help the author, and it certainly doesn't help the editor, and it doesn't help the entire process. So if you have very little to say, that's fine, that's okay, but at least comment and make something commentary in terms of helpfulness to the authors in terms of how it could be improved. Almost every article can be improved. Fairness and objectivity, of course, is what we expect from a referee. And if you do have a conflict of interest, we would expect that that would be declared. It's a fascinating thing to find that when people ask for preferred referees, believe it or not, they're often the harshest of referees. So in other words, someone that you know, someone who's your best friend, is often going to be your harshest critic. That's usually well meant, and it's usually well meant to improve the quality of the work that comes out. And of course, it's reflective of the fact that they are very much expert in that particular field. It is crucial that you maintain the confidentiality of the process. It is not okay to refer to the fact that you have refereed someone's work. You should not contact authors to say that you have done so. We had recently a challenging thing at BJS where somebody submitted a paper. The paper was refereed. The paper was not accepted in BJS, but did go on to go somewhere else. In the intervening period, the referee referred to it in one of the papers that they were writing for another journal, and they referred to the fact that this work had been submitted. And that, of course, is not appropriate. It's a breach of confidentiality, and it's a breach of the whole process. Interestingly, they didn't appreciate that or did not understand that, but were very gracious in their apology once they did understand that this was a breach of ethical behavior. Not a serious breach, but one that perhaps many of you who are new to the refereeing process may not be familiar with. So I wanted to get that out there. You have an obligation, of course, to communicate with the editor. I'll touch on that in a moment as to what you can or cannot say to the editor. And in particular, it's important to make a communication to the editor where you feel that a work in particular has ethical issues or some degree of inappropriateness in any way, shape, or fashion. Or, as I said earlier, if you feel that the authors have a conflict of interest or that you have a conflict of interest in any way. Essentials in the refereeing process include some of the following. You want to ask yourself, is this work credible? Is it believable? Is this appropriate? Is it realizable in the modern world? Is it ethical? Ethical is an interesting thing because ethical brings all sorts of professional questions. It brings in personal questions. For some, it brings in moral questions. For others, it may even bring in religious or other aspects of life. But no matter what it is, if you feel that there is an ethical challenge or difficulty, it should be dealt with. It is important for all manuscripts submitted that there is an ethical statement, in particular those relating to patients. Fascinating in a modern world, we are only just beginning to grapple with the concept of social media and people putting up patient images and people putting up operative images and people putting up anything like that that is personal related to the patient. I didn't think it needed to be said, but it is now getting out there that really that should not be done without the patient's expressed consent, nor should the patient be individually either named or identifiable. That personally, I think, is challenging to do where you're publishing patient images, particularly from an interoperative, and that should be done very clearly with the patient's understanding. And that, of course, raises, as I'm sure you all understand, some very ethically interesting questions, because if you're asking someone in the delicate post-operative phase whether or not you can or cannot post their operative images, it's probably, I think an ethical expert would say it's probably not the best time, that there is a hierarchy of surgeon to patient under those circumstances, and that perhaps they're not capable of making an independent, uninfluenced decision in that circumstance. And if you take that and you extend it into the generalizability of ethical publishing, it's a good way to start. What is it that you would want? known about you if you were one of these patients. And just because they're de-identified is not acceptable, particularly where you're referring to small patient numbers with complications, etc. Is the work original? Now, original doesn't necessarily mean that the whole concept is new, but it does mean that is it original? In other words, that it has not been published before, so no aspect of it has been published before. There are degrees of overlap that are acceptable that I think we'll be getting into over the next couple of hours. But as a general rule, something that has been published previously should not be done again. Another good example of where you can get yourself in trouble with plagiarization, for those of you who are new to refereeing, you can plagiarize yourself. A lot of people don't know that. We had another circumstance about a decade ago at BJS where somebody submitted a review article to BJS, and in it, when we put it through the Authenticate computer program that we run, about 45% of it had been previously published. When I contacted the authors about this, they expressed their shock and surprise that this was considered plagiarization because it was work that they had previously published, and they were lifting segments from previously published articles in order to compile it into a review article. And I had to point out to them that, strictly speaking, that is plagiarism. Yes, you can say, but I'm saying the same thing, Des. I'm saying exactly the same thing, just with different words. Is that not plagiarization too? No, but lifting segments of work from a journal is not appropriate because you sign your copyright over to the publisher, and therefore it's a breach of copyright to literally lift it exactly word for word and to transpose that into a new article. That's a good example of poor publication ethics and lack of originality. Obviously, manuscripts should be clear, and you might say that's the editor's job to make it as clear as possible. It is, and I think we all do a reasonable job of doing so. But the job of the referee is to say, this is not clear, this is not understandable, it isn't objectively understandable as to exactly what it is that the authors tried to do or tried to say in a sequential fashion with absolute clarity. And then, of course, relevance. Relevance in particular refers very much to, is this relevant to the journal? Is it an appropriate specialty? We get a lot of submissions. I know all of my colleagues here today, we get a lot of submissions in various fields which are outside the scope of interest of BJS. And whilst we're prepared to accept the submission and to consider it, it's probably not the best place for subspecialty work like pediatric urology, to use an example. Pediatric urology is probably better going into a journal which is specific to that, because our readership doesn't really, grasp that particular aspect. Furthermore, it can be difficult to get referees to do so. So having to think about where your target journal is clear. And as a referee, one should be thinking, is this the right place for this work? Now, in terms of going through some of these points bit by bit, in terms of the sort of credibility of something, you can usually find out in the last paragraph of the introduction, there should be a very clear hypothesis. Somewhere around there should be the aims of this specific article. What is it that you wanted to do? What is it that the authors had in mind? And it sets the tone as to the rest of it. The next is the study design valid? In other words, is there protection from bias? Is there no confounding, etc.? Is this an appropriate way of doing something? Were they using an appropriate methodology? Were they really doing something in a prospective way? One of my little pet peeves is when people refer to looking back at a database that was accrued, what they say prospectively. Well, sure, I understand that. But if you don't decide what the concept is from the beginning, a priori, if you do not do that, then this is not a prospective study. It's a retrospective study based on a database. And if you think about it, most databases are filled in a prospective fashion. Very few are actually done completely retrospectively in terms of time periods. So I don't think that's an appropriate. So there's a good example of where you can biasly confound the reader of an article, and where you as a referee can actually say, I'm not entirely convinced this is a prospective study. It was not registered in advance, for example. And then, of course, is there a clear message regarding ethics? Ethics varies from country to country. Some of the Scandinavian countries, as you may know, have, I think, entirely appropriately, a very reasonable ethical waiver for retrospective studies on population design where there are large-scale data, therefore it's anonymized or de-identified data. And I think that that is appropriate. Most institutions, however, will have an institutional review board or an ethics committee, and it should come, particularly prospective studies, and particularly studies which are done in a randomized trial, for example, should come with a very clear message of ethical submission and ethical approval with a specific approval number. That is an absolute requirement to do so. And that's, of course, to protect ourselves from things. And those of you who are interested as referees and are interested in the academics of this, just look back at some of the historical things that went on, from using prisoners, from using people who were interned for various things to test drugs. And then, of course, there were a number of very famous things. And in fairness to the United States, they've been fantastic about holding hands up about what has happened many, many years ago, you know, in the last century, when there were, Tuskegee was one example where penicillin was tested on a particular aspect of a community in a blinded fashion from the point of view of the patient, but the patient did not know that they were entering into a trial. They believed that they were taking penicillin, if I think it was for syphilis, if I recall correctly. And they've been very good about saying that was not appropriate, this isn't right, there are much better ways of doing this. And there are all sorts of wonderful declarations over the years which determine what is appropriate and what is not ethical. Now, it should be very clear from the introduction and the discussion exactly what it is number one, wanting to do, and number two, their interpretation as authors of as what it is that they did do. I think one should always check the bibliography, you should always check the references for appropriateness. Among the things that I will do if I referee something is I will look to see are the references in any way up to date? Are they out of date? Are they from the last century? Are they 20, 30 years old? Sometimes that's appropriate when you're talking about the history of something, but it's not appropriate when referring to the contemporary contextualization of that current study. Check keywords and authors on PubMed, Medline, and other such lines. I think that's important to see what's out there and have they published on this before, and have they published any aspect of this before? And if so, has that been declared? Finally, of course, a good referee should know the literature. One assumes that if you're being asked to be a referee, that we expect already that you are A, an expert in your field, and B, that expertise manages in some way to cross over into this particular area. There are times when we're all asked to referee papers which do not fall within our expertise area because they are generally about the general aspect of surgery and surgical science. In that aspect, I think it's important as a referee to specify, I do not feel qualified, if you like, to refer to the advanced statistics in this, and I would recommend a statistical review if appropriate. That's something you put in a comment to the editor, but here is what I can say to the authors. And I think that is a nice thing to be able to do for both authors and for referees, and it keeps us all honest and above board. Now, clarity. It should be comprehensible from the abstract alone what it is that the authors are trying to get across to you. All too often, the abstracts are missing vital information. They're missing balanced results. There is a lot of spin looking for, significance and positivity, as opposed to actually presenting what actually happened and what the results actually were, letting the reader decide whether or not that it is impactful or clinically or statistically significant. All of the information should go in correct sections. Some journals more than others spend a lot of time and effort making sure that this is appropriate. I do believe it's essential that introduction does indeed just have the introduction and the aims, that the methods only contain the methods and not results. It should not contain, for example, how many patients were accrued in this study. That's actually not a method, that is a result. So anything that you did not know before you started thinking about this study is a method, and anything that everything that you did know is a method, and anything that you didn't know from the initiation of the study is from then on a result. And then, of course, discussion. Some journals vary in this one, so I won't comment on that. But BJS tends not to have any results in the discussion. No p-values, no numbers, nothing like that in the discussion. It just gets confusing. Personally, I don't like it, and the reason for that is very clear, and that is as a reader, when you're reading that, you have to flip back and forth, back and forth, back and forward to do things, and you're now reading contextualized results inside a discussion with actual results in it. And it's just a little bit difficult for the early career reader. Finally, do the authors stick to the point? They usually excessively discuss. So anything that goes past a couple of pages of discussion is almost always unnecessary. Now, statistical methods terrify us all, don't they? Because very few of us are truly statistical experts. We have statistical experts in almost all journals, and you can rely upon us to actually look at those statistics, particularly if as a referee you specify we think that this needs a specialist referee looking at it from a statistical point of view. I'm sure the other journals do this too. At BJS, if something comes in that is a randomized control trial, we automatically always put it through a statistical methodologist. Do the findings have some applicability? In other words, it's all very well presenting something which is novel and exciting and new, but in terms of its applicability in the world, and one should think about the world not only from your own sphere, of course, but also how applicable is something like this in a low middle income country, in parts of your own country where you may have lower ability to have high technology transfer, etc. And if all of those things are a challenge, well, then it should just be very clearly stated. I mean, I think the early days of robotics would have been a very classical example of that, where it was all very wonderful talking about the benefits of robotic surgery, but they were so wildly expensive that they were far beyond the capabilities of any low middle income countries, and they were certainly beyond the capabilities of small hospitals in rural parts of most of our countries. So I think we need to be very clear about those statements, particularly where you view that from a patient's point of view, and it should be balanced. So that's not to say that we should expunge or relinquish or not publish that work, but it does need to be heavily contextualized. And I think that it is the responsibility of the referee to initiate those discussions. And it's our responsibilities as editors to be sure that that does indeed happen. Biologically meaningful or clinically important is a very good question to ask of yourself. Biologically meaningful for those of you in refereeing for journals where you're going to get some scientific content, and of course clinically important for those of you working with clinical journals. And finally then, does the subject matter actually have appeal to readers? Because some of the work that we get, with all respect to all authors, some of the work that we get may be very biologically meaningful, might even be clinically important, but the subject matter is extraordinarily obscure, not entirely appropriate, and maybe not entirely appropriate for this specific journal. A very fast overview of what should be included in the referee report and how to think about it. If you just think of why, who, how, what, how, and what. Very nice, easy, simple way of remembering it. Why was the study done? That should be the introduction. Now note how much of the others, I've highlighted it for you, how much of the others relate to the methods. Who was studied? How was it studied? What interventions were involved? What outcome measures were used? How many subjects or what kind of subjects were involved? All of that is in the methods. A little bit of the results, but all in the methods. And then finally, what's the relevance of the study? And that should be in the conclusion. Note that the anchor of a good paper is in the methodology. And that's really where the advanced good referee knows to look for the potential strengths and, of course, the inherent weaknesses, because let's face it, almost every study has something that you could criticize or some limitation or weakness. That's not our role as a referee. Our role actually is to look for the strengths, to look for the gem, to look for the positives, reflective and balanced by the negatives, but to look for the positives. I think one as a referee should write an introductory paragraph to the authors that sets out a little bit about that you have an understanding of what kind of study, what they tried to say, what the main findings were. You don't have to repeat them all, but what in essence are the main findings and what the conclusion was drawn from that. And then from there on, you can go on with some number of points. Personally, I do not think that you should say whether or not the study was good or bad. I don't think that you should say whether or not it should be published or not should be published. You should just critically appraise it, simple as that. Next, I do think you should go on to those numbered points, little short sentences, just talking about the scientific credibility, originality, if that's appropriate. Comment on the study design, particularly if there's something in it that you could improve upon or something in it that you think should be discussed as a limitation. Something about the results which contextualizes it somewhat to prove that you do actually have a good grasp, a good understanding, and any aspect of that that the authors could improve. And then, of course, something about the applicability of it. I think if you can identify for the authors or for the editors where you think things need to be clarified, and making sure that each of those is very, very clear and unambiguous. Try not to stray outside yourself as a referee. When I get asked to be a referee as opposed to an editor, I don't talk about publication. I don't talk about whether it's appropriate to be published. I simply talk about the veracity of the work, the clarity of the work, the relevance of the work, and then I let the editor decide between them and the authors whether or not that's something for that journal or not. And then finally, I think offering information to help the authors is really nice. It's really nice to be able to say, not just, well, I enjoyed reading this, here is what's good, here is what you could improve. And in particular, if you've got something very important to say, please make sure it's objective and that it's evidence-based. It's not really fair to authors to say, I suggest you go off and you do an entire other study. That's not really the question of you as a referee. And you're not there to referee a thesis, for example. That's a different story. When you're asked to do a thesis, different stories to what should or shouldn't be done or where the next direction is. It should only be upon what you have in front of you. Is this enough? Is there some aspect of it? Or you could say within your data, I think it would be really nice if you could produce a little more granularity on this specific point, because that would be great for the readers. And then it's up to the authors to be able to say to us as editors, that's not appropriate, or we don't have time, or that's not something we're able to do at this time, or that's something that we want to consider for another paper at a later time. Coming to the end, consider the need for general remarks like those relating to language, grammar, length, and style. I think that's particularly important as we are in a global world where English for scientific publishing for many countries is the lingua franca. It isn't for all, but it is for many. And unfortunately, some of the submissions that you will get from around the world will not have English as their first language and will not always have as good as grammar and style as you, an English-speaking person, would have. So our role is not to sneer at that, not in any way, because I don't speak any of their languages. It's to identify for them where grammar or English or language or syntax could be improved upon. And the best referees will actually have it identified. On page 4, line 3, I would suggest the following instead of what you have written. That's actually tremendously helpful, and you'll find that authors will hugely appreciate your efforts in that. And then finally, I don't think one should ever comment upon acceptance or rejection at all in the referee report that you write. That's the editor's role. What are you going to say to the editor? Well, you don't have to say anything at all, because you can actually say, see what I wrote to the authors. I have nothing else to declare. But if you think that there's something to do with the ethics, if you think there's some degree of redundant publication, that they've salami sliced, that there's some plagiarization, if you're concerned at all that there's something slightly amiss about the authorship or something else, or that you just think, wow, I mean, did this actually happen? Is this credible? Is this actually believable that someone could have done this? If you know something about the morality, the cultural sensitivity, the probity, the ethical aspects of things, something that you wish to even just raise as a question, say, look, I don't want to make a comment to the author because I'm not sure, but to me, this just strikes me as just a little bit unethical. There are parts of the world, for example, where there are papers on transplantation, etc., and it is not always abundantly obvious what degree of ethics there are to that. And one again, it hears talk of there being utilization of organs from prisoners and things like that for transplant programs, and things that we would consider, I think, in other parts of the world to be inappropriate and perhaps unethical. And I think if we don't, as referees and editors, stand up and actually call that out and say, no, that's not right, not appropriate, then unfortunately that propagates and keeps going. All it takes for evil to prevail is for all of us to do nothing. Probity, think about sponsorship, think about commercial input, and think about whether or not this study was sponsored by a commercial entity, be it a drug company or a firm making some aspect of surgical equipment. Think about conflicts of interest or potential conflicts of interest that there may be, that particularly if they're undeclared. I think most of us are pretty good these days about actually having that. USA journals in particular are fantastic about having a very specific thing which requires you to make declarations as to whether or not you do or do not have any commercial interest, whether or not you have shares, whether or not you have had any involvement in a company, even if it's working as a consultant, even if it's working as a paid member of the surgical community, but in that aspect of that talk or whatever, that you were sponsored in some way by those things. Most of the time, those things don't really actually introduce any serious conflict of interest in terms of shaping what it is that you say, but it should be declared, because if it's undeclared, it implies that there is some relationship which is inappropriate in some way. Gross inconsistencies, of course, that you would put that into the thing to the editor, something that you think are just, completely, unbelievable and not something which is possible in a modern world, and frankly, just, possible thing to grasp. And then, of course, finally, is the suitability for the target journal. So just to finalize, there are the responsibilities on the screen of a referee. And perhaps the most important are to be prompt, to be fair, and to communicate what it is that you want, not only to the authors, but to the editors in a professional and capable and timely fashion. Thank you.
Thank you so much, Des. Thank you very much, Des. That was a real complete review on the topic, and there's a lot of information there. We're going to talk about many of the points that you brought up in the second part of the study, of our webinar, sorry. And right now, I'd like to give the floor to Lee Swanstrom, who is Editor-in-Chief of Surgical Innovation. Lee, you have the floor.
All right, great. Thanks, Abe. Thanks, Steve and Kevin, for asking me to be involved in this. Certainly is a very relevant topic. There's maybe a little bit of background noise. We're having a storm here in the south of France, so you may hear a little thunder in the background. So Des kind of stole my thunder to some extent, relevant to thunderstorm, and talk a lot about that. But maybe I'll get a little bit more down in the weeds and talk about really practical points for doing a peer review. It's kind of spoken from the standpoint of a journal that's in the middle of the pack. In fact, usually surgical innovation is right in the middle of it. So we're not a Nature, British Journal of Surgery, or New England Journal. So we kind of have more of a problem obtaining good peer reviews, I would say. In fact, often when we get together as journal editors, we talk about a crisis in peer review. I think most of you would be happy to review if you get, if Des sends you a request for a review for the British Journal, but some of the other journals can have some problems. So as you heard, the peer review process is an intrinsic part of all scholarly work. It's part of the scientific process. It's a critical assessment process, and it has to be unbiased, independent, and really from the outside. And that's been known for a long time. I say that there's a crisis, kind of why do I say that? Well, there's many elements of that. Exponential increase in the manuscript submissions. It's amazing how many manuscripts are now submitted. There's a disproportionate increase in the number of scientists available for review. So the number of clinicians, number of scientists has stayed basically the same. At the same time, journals or articles have increased. There's a definite problem with predatory journals stealing reviewers, which could be a whole nother topic about some of these predatory journals. They kind of dilute our ability to obtain good peer review. Increasing competing responsibilities, especially for senior faculty and academicians. All of us are stretched to the limit, especially with COVID, and having the spare time to do peer review is more difficult.
Lee, I'm sorry to interrupt. Can you use the presentation mode?
Sorry
for
about
your
that.
slide? Sure.
So Abe mentioned, whether there's a reward for the reviewer is really a question that has to be answered, and I'll talk about that just briefly. And I think the electronic submission system is great in a way, and it's certainly necessary, but it hasn't done a favor because it allows kind of random choice of multiple reviewers, and everybody gets a little bit tired about that. So when you're a middle journal like Surgical Innovation, you often are confronted with this on the electronic editorial panel, declinations, unavailabilities, et cetera, and it's not that unusual for us to go through 10 or 12 requests for review before we get a minimum of 2 reviewers. So what's underlying that? Well, certainly when I was trained, being a reviewer was considered an academic honor, kind of a level of it. If you're asked by the British Journal of Surgery, this is from my CV, you certainly were flattered, and it fit into your curriculum vitae. I'm not sure that's necessarily the case anymore. Maybe for this generation, it's less of an honor and more of a burden. And I think we have to do everything we can to make it less of a burden. So who are the stakeholders we're operating for? As Des said, the authors, certainly the readers deserve quality, often have to pay for the journals they subscribe to. They deserve quality content. The researchers need honest feedback. The journal bases its impact factor on the quality of its publications. I think you learn a lot. I enjoy reviewing because I get to see what's new, what's the latest, what's up and coming. And so I find it very informative. And that's probably the major reason that I continue to review quite a bit. I think in the end, though, the public, if you put out bad information, as we see in politics, it's going to trickle down and hurt society in the end. And good, honest, above board review in the end is going to trickle down to our patients and make sure that they get good quality care. It certainly is a time commitment. I think you can expect to spend between 20 minutes and 2.5 hours on doing a really good review. That's a lot to ask from somebody. I think what peer review isn't, and you already heard this, is it's not a criticism of the authors. It's not negative comments about something, and it's not editing or proofreading the submission, because that's the job of the editorial panel. So what are the elements of good review? And Des kind of ran through this. Importance of relevance, originality, ethics, et cetera, I won't go through this again. You kind of heard it. But you need to include all of those, and at least touch on them in your mind if you don't actually write them. So these days, almost all of our reviews are done on an electronic platform. This is from our journal. It's kind of what it looks like. Usually you're asked to give comments to the editor-in-chief. You're asked to give constructive comments to the author. And then you're often asked to whether you want credit, Publons being the most common for your review. So this is kind of what you're faced with when you start doing your review. I think in the comments to editor section, you heard a little bit about this already. Overall quality, brief mention. I can tell you editors are pretty busy people, and they don't want a long essay about everything that's wrong. and you don't necessarily have to just copy and paste what you sent to the authors as well. So a couple well-placed sentences about the relevance, major issues that you detected, kind of the appropriateness for the journal, because every journal now has a very specific focus, and your opinion, of course, on acceptance. And many of these are for the publishing staff to handle and not for you. Comments to author, once again, you heard this: honest, above board, scientific, critical opinion. So you want to provide criticism that's constructive. Style of writing, especially its clarity. Did you have to read it 4 times before you understood what the author is doing? Rating the work's detail, methodology, relevance, accuracy, and originality. You don't want to say anything personal. I think this is crazy, or what are they saying? None of that fits into this. So you should maintain your professionalism. And certainly, as Des pointed out, you don't want to use what you read in these advanced publications for your own use. That's a breach of confidentiality. And you shouldn't directly contact the authors without permission, although there's often an opportunity, and Mike Saar from Surgery was really one of the paragons of this, of signing your review at the end. Certainly, we don't mind if you want to do that. It's elective for most, but it's not a bad thing to do. So just some of my concrete descriptions of what I like to see in a comment to the author. As Des said, a brief summary of the paper from your perspective. So you don't want to just repeat their abstract. So the authors present such and such a study of how many patients having such a process. The results showed this. The authors conclude this. So just a very concise, very good summary, totally from your standpoint. There. Make some general comments on the importance of the subject. This work covers a obscure subject or a very relevant or timely subject, and would be an important contribution or a minimal contribution to the literature on this subject. General comments on the paper's quality, how the paper is written, constructed, put together, whether it's too long, too short, how they could improve it in a bullet point format. If certain sections are in the wrong position or they're too long, that was already mentioned before. And then a comment about the references as well. If all the references are from the early 2000s or the 1990s, that's a little bit of a signal, and this paper might have been floating around for a while and may need to have the references updated as well. And then, of course, the main parts: criticisms, suggestions, and questions, all with the aim of improving the work. And examples would be: the author should include such and such a reference. This figure is redundant and could be deleted. Obvious discrepancies between the methodology and the results, or the results and the tables that are there. If there's obvious misspellings that really contribute to making the manuscript difficult to read, that could be pointed up, although you're not a proofreader. Additional information that might be included. If they forgot to include critical elements in their paper. And then a discussion of their discussion, if you will. So if they say this in the discussion, but you feel like their results don't really support this, you should challenge them on that and ask them to further support their conclusions based on the results. And then and then some technical questions in the methodology. What kind of study format was used for this? What kind of is this a prospective study? Was it done based on a database? Where did the database come from? all those technical aspects of the methodology. So I told you I'd be fast, Abe. So just to wrap up real quick, peer review is certainly an essential part of medicine and a critical element of professionalism. And I think that's a big reason to contribute to peer review. Please don't say no to a peer review request, but you can certainly be selective, because sometimes you send it to the wrong person. They don't have an expertise in that. And certainly you don't want somebody that doesn't know what they're talking about to be doing the review. Please be fair, be honest, but always be constructive, because remember, the next time it'll be your paper that's going through the process. So thank you for asking me for a few brief comments.
Thank you so much, Lee. That was very enlightening, as always. I would like to open up the discussion now to the rest of the faculty on any of the points that you've just heard. If I may serve as a sort of like a prompter, let me start out with Leo, because you're on the top of my screen.
Thank you very much. Yeah, I think it was refreshing and always good to go to all these topics. I have a question. Our journal is also screening all submitted papers only since this year through these identical identicate scores, similarity scores. So each paper that is submitted comes to us with this score. And the highest I've seen since a few months only was 47% of identity already published. So I sent it back to the authors. Now, what is I even asked the question to our publisher, what do you have recommendations? What can we accept? I mean, I think below 10% is fine, but should we go below 20 or below 30? What is the consensus of what can be accepted to go straight through the review process, or what should be stopped before? What is your advice?
Well, I don't have an exact number. I think it really, I think you have to dig in and see what exactly the material is that was duplicated. I think that's part of it. Sometimes if it's methodology, then you would forgive a higher score. But you know, Elsevier doesn't really give our editors an exact number. We want you to look at what's taken. That's just as important as the number. So I will have the other editors of journals comment on that.
I think that's, yeah, go ahead, Ed.
Anybody else have something to say? Yes, please.
Exactly. It's not so much the percentage as, because the percentage, remember, takes in how much of all of the words are copied. Many of the references and things, for example, will often be copied from one to another, and that's not an issue. But if I see something that's 20, 30, 40% copied from somewhere, I would like to see where it is that the copy is. If it's methods and references, fine, I have no issue with that whatsoever. However, because there's only a certain number of ways you can say PCR or whatever study it is that you've done. However, if it's introduction, results in particular, that'd be awful, or discussion, that you've lifted large segments, then a percentage of that, even if it's 10 or 20%, is unacceptable. So it's not so much the percentage, it's where it is that it's copied from. I'd say results never, introduction shouldn't be, and discussion definitely not.
Very good remark. Yeah, that's
Yeah, you can actually customize the authenticate report so you exclude references. And another thing that often is picked up is the parts of the study that the authors have done. For example, conception of study and those kind of things are often picked up. I generally use less than 5% from any one source, or I'd like to see that. But there are many things, like Des said, that are methods, scientific methods, PCR methods, that are very hard to reformulate or say differently. But it's sometimes surprising how many times people have actually presented at meetings, had their abstracts published in other journals and then have just copied and pasted the whole thing and not declared that they've previously presented it or previously had it published.
Yeah. Des, I would like to ask just a small question about the plagiarism of self-citation. There's a very famous paper. I'm not going to go into much detail, but I will say it's coming from the United States, and it's coming from a very prominent center in pancreatic surgery, where there were several parts of the methods that were exactly the same. The numbers changed. However, the first author was not the same. Now, does that change the problem any bit? Is that an issue?
It's always an issue if there is large segment plagiarized or borrowed from somewhere else, if not referred to. I mean, you've all of you, each of you have either done this as an editor, and you've certainly done it as an author, that you can, even in those studies where there are follow-ons, randomized trials, etc. Obviously, the methodology hasn't changed. But what you can say is, as published previously, reference, and then you can summarize for this particular one. And in that way, you're not plagiarizing something. So it should always be referred to, and it should always be declared, irrespective of who it is who's doing it and who it is who is now writing this particular instance of paper. So personally, don't like it at all, and there's absolutely no requirement or reason for it. And you can always shorten it by saying this has been previously published reference. If you do that, there's no issue whatsoever. If you try to sneak it under the radar, you'll get away with it a lot of the time. But if you do get caught, that's not nice. So it's reputationally damaging, and it tends to be reputationally damaging for the senior author. The person writing the paper, if a junior author, doesn't necessarily get anything other than a smack on the wrist for it, but it can be reputationally damaging. And the one that I referred to earlier on, at the time, the BJS executive were seriously considering getting onto the COPE people, that is the sort of publication ethics, about the fact that he had lifted large segments of his own paper. And I had to get on the telephone to say, if you don't stand down your position, you're going to get reported. I don't want that to happen. I want you to withdraw the paper completely and never do that again, please. And then that's how we resolved the issue. Otherwise, it was going to get really nasty.
Abe, maybe I'll say one thing is words are one thing, and replicating the words, but really what you don't want is them to publish this essentially the same study again and again, shuffling the authors, and even if they go through and change all the words so their duplication is 10%, you have to be a little bit aware that they can still be reporting on almost exactly the same study.
But yes, that's very, very good. That's actually one of the topics that I wanted to bring up in a few minutes. But before we go to that, just one question to you specifically, Lee. In your letter that you sort of, let's say, a stereotyped sentences with words that you have to fill in, what would you think, and what is the opinion of the others about a checklist? As many journals have a checklist on all those issues. Would you leave that up to the author, the peer reviewer, or do you have to have, or would you prefer having a checklist? What do you think about that, Alberto?
I also work in the editorial office of techniques in constructology. Yes, we do have a checklist for that before we start the review of that. And I think it's useful. I also wanted to point out one thing, as I have quite an experience with meta-analysis. There, the methodology of a meta-analysis is quite always the same, especially if the topics are not that different. So in that case, I would, of course, I'm not saying a word in favor of self-plagiarism. Don't misunderstand what I'm saying. But if you are an expert in methodology of meta-analysis, actually the methods there are pretty much the same. So I like very much what Des has pointed out, that you have to check paper by paper and understand where the sentences are reported from. Because in that case also I would close an eye on that and would not take any consideration, of course. It's his own work. He is reporting the methodologies as it is. Why do you have to blame them for that? I think that in future we, as editorial offices should offer the possibility to check plagiarism automatically, which we do now at the Techniques in Reportage, but as Tess pointed out, the literature is included in the manuscript and it is ruled out as plagiarism, of course. So probably we should ask the authors in future to separate the documents and have the literature taken out and have very strict rules that we should, as scientists, define exactly what they are. And I think 10% makes sense. But more than just the total amount, I think that we have to be aware if there are entire paragraphs, entire sentences taken, which is quite annoying to me. I think we all agree on that.
Thanks, Alberto. Anybody else want to have a word on that before we go on to the second section? Yeah, Wolfram.
I just wanted to comment on what has been said on the numbers of duplicate words. And I would first agree that, of course, you can be selective in checking that. Susan referred to that. And Alberto also mentioned that, of course, it's more than the pure number, the content. And what is so important is what Des said, that, of course, you need to check in detail whether that was referenced or not. If the article has a larger component of review character and everything, and that is referenced, you will of course have a higher number than 5% or 10% of or likely you will have a higher duplication rate. And if all that is referenced, I think it's at least fair. Whether it's nice to use the same words, it's another thing, but I think that's a completely different story if it's referenced. So even though the editorial offices may make life easier for us checking beforehand, we still need to read the article regardless of the number that comes out.
Yeah, okay, thank you. Thank you very much, Wolfram. Okay.
Just
Yes,
a quick note on the authenticate. I think this is a good point that he was making, is that really we cannot count on the publisher to go through the authenticate, because it's just not the number. We need to also have all of the editors being on board, kind of understanding what the report is to really structure it. But I think what Susan says is that if you can actually delete some of the automatic parts, that would be very helpful. But this is something that, as we all know, within the even the editorial team that's working on the papers, still sometimes it is a challenge to get everybody on board, because everybody's doing it pro bono. So the time is limited. So this is another thing that we kind of need to educate also the editorial staff that we have on within the journals.
Very good. Very good point.
There are a lot of, Abe, there are a lot of chat comments. I didn't know if you wanted to address them as we go along.
If I can share my screen. Everybody see my screen here now?
Yep.
I saw this paper recently, and really it's something extraordinary when you think about it. The time that reviewers spent on peer review was astronomical. When you think about the idea of, when you think about the numbers, we're looking at something in the upwards of billions of hours worldwide. And the estimated monetary value of the time that reviewers spent on reviews for nothing, because they don't get paid, most of them don't get paid at least, was also astonishing. $1.5 billion US for the US-based reviewers, $600 million US for Chinese-based reviewers, and $400 million US, I'm sorry, not pounds, for the United Kingdom-based reviewers. And the authors said, by design, the estimations were certainly underestimated. I'd like to touch on, we've talked about duplicate words, and I'd like to touch on ambiguous words. I would like to know what the rest of the faculty thinks about the role of a peer reviewer in detecting and pointing out ambiguous sentences, and especially one particular ambiguous word, in my opinion, and that is the word significant. When the word significant stands alone. And if I just may make a point on this, we all know that significant means important, large, impressive. And when we see it in a scientific article, we obviously think it is probably talking about statistical significance, but people don't understand that. The people that read it, they just take away the message statistical significant being something that is important. It's something that has come out of the literature. Ronald Fisher, who was responsible for the p-value, actually used the word, this result signifies that. And from that, everybody has taken up the word signify to be significant. And this is where the significance in statistics comes from. I really would like to point out that I think that the reader reads what he thinks, and it's not always that he understands that we're talking about statistical significance. Unconsciously, he takes significant as being important. Here's an example. And when you read the article, there's nothing mentioned about anything that's statistically significant. So I would like to open the discussion here and see what the faculty thinks of the idea of making sure that a peer reviewer says, when you talk about significance, that you talk about statistical significance, or that you do not use the word significant. I open the discussion there. Anybody from the audience, as a matter of fact, can also join us as well. Anybody want to?
So Abe, maybe I'll just comment. You probably know this quotation from Mark Twain that there's what kind of lies are there? There's lies, damned lies, and statistics. So yeah, I think it's even a broader subject of that. Sometimes that's an innocent mistake because significant, is an adjective that can be used for other reasons. But when people kind of manipulate statistics to kind of do that, and a lot of the peer reviewers aren't experts in statistics, and some of the comments online are mentioning that, that can be a real problem.
Yeah. What would you think, Des? What's your opinion, Des, on that? And Susan, I'd be very interested in hearing what you have to say on that as well.
Yeah, the biggest problem with it is we've kind of all alluded to this already, is if you're going to use p-values, you often confuse the neophyte. You often confuse those who don't quite grasp what that actually specifically means. One of the commonest actually problems that people say that something is significant when it has a p-value which isn't less than 0. They say specifically, we consider p less than 0.05, and then they produce something which is, when you bring it down to those digits, it isn't actually less than that number. And even if it does, or even if it touches on it, or even if it's close, it's not quite what you decided in advance. Other common problems with statistical errors are where you don't have a correction factor for multiple tests. And that's before we get into the whole problem of using the word significant in isolation. So using p-values in isolation or using the word significant in isolation is never appropriate. And there's a huge difference between something which has statistical significance as opposed to it being significant. So it only should be really statistically, this achieves the statistical significance that we from the onset said that we would require as a threshold level. That's one aspect to it. The other is whether or not that is actually of any clinical impact whatsoever. And a very common one is in randomized controlled trials, for example, where people put in p-values and significant values, alongside where you have, this is what was tested and this was the control group, you shouldn't have p-values in that, because if you did the randomization process appropriately, there shouldn't be any statistical difference between the two. And then the flip side of that is when you see large population studies, it's pointless putting in statistical values on most of what it is that you do, because when you have thousands and thousands and thousands of patients, there will be statistically significant differences, but that could be hair color, it could be eye color, it could be anything. And it's a kind of a pointless thing to do. So personally, I like to see large population studies. You do not require statistics. You just record it as it is and let the reader decide. And where you're doing advanced statistics in order to achieve something, I always think, I'm not sure about this. If I've never heard of the statistical method, if I've never heard of that particular test, I'm deeply suspicious from the onset that I'm getting duped in this. And I want to actually see what is the raw data. In particular, I want to see the actual numbers, and I'd like to see something presented, in a table or something. I personally don't like when people just do mean, standard error of the mean, or if they just do median and interquartile range. We'll happily, as a journal, put it into that to make it digestible for authors, but I would like to see some granularity to the raw data. And this introduces a lot of concepts for me, which are coming down the line, I think, for all of our journals. And that is where we'll actually have database publication in the back room. We'll actually have the entire data, or you'll have your data in a repository in advance of you submitting it to a journal. And I think that might get rid of it, but I completely agree. As a group of editors, I think we should get rid of the word significant, if at all possible, from journals.
Thanks, Tess. The question arises then whether this is the role of the peer reviewer. Is it the role of a statistical reviewer? Who should be doing that? Who should be pointing that out? Susan, what do you think?
Well, it's a difficult, Des pointed out some of the important parts. And one of the chat questions was, is a statistical background necessary for a reviewer? And that's a hard question. There are so many different types of articles coming on now, things on cost effectiveness analysis, things on different kind of genetic studies. So requiring different types of statistical expertise. And one of the most common problems is studies that aren't really statistically powered to show what they're trying to show. And I think it's very difficult for many reviewers to be able to evaluate these. And the incorrect use of significant is very, very common. And one of the dilemmas that, for example, I confront very commonly is getting randomized clinical trials sent to me that are underpowered. And it's a dilemma. Should you publish these or not? And it's the whole thing where our next discussion is going to go on meta-analyses. There is such a decrease in the publication or performance of randomized trials by surgeon, I think, nowadays. Everybody says you should have large randomized trials, but they're very hard to do. They're very expensive. So is publishing a randomized trial good, that it will someday be then used to do a systematic review, in the future be used to do as part of a meta-analysis by somebody else? So a lot of things to consider.
Okay. Yeah, thanks very much, Susan. That's very important points that you brought up. You've actually touched on something that I did want to talk about also in the second section. We'll put up just a few slides to bring out some examples on that, if I may. Share my screen here. Oh, sorry, down back to where I was. Let me go a bit further here. Okay, you brought up a very, very important point, all of you, as a matter of fact, and that is, what is the role of a peer reviewer in checking that the contents, the title, and the conclusion are talking about the same thing. Very often I've had the problem of a title that looks very enticing and the contents are pretty well done, but the conclusions have absolutely nothing to deal with. They don't deal with the topic, they don't deal with the title, and they are sometimes misleading. And one of the misleading, most important things is what Susan has just talked about, is that the study is underpowered. A study that's underpowered, theoretically, the author should not come to any conclusion. He should not say strong words saying that what he hoped to find, what he hoped to prove, and state that in the conclusion, saying, yeah, our study was underpowered, but still A is better than B. And there's even a word that's come out into the literature, which is called spin. I know that people have heard about that. It's when you have a potential incorrect conclusion based on a faulty analysis, and it stands out as the conclusion, and it should not be allowed to remain in literature or be cited uncritically by others. Now, is this the role of peer reviewers to point this out? And how can we, let's say, make peer reviewers aware of this problem? Yeah, can I have your opinion on that?
I think editorials are very useful for this.
Sorry?
I think editorials are very useful to point these things out.
Okay, that's a good, very good suggestion. And I think that Steve and Kevin have agreed that some of the topics that we're talking about today will be the topic of editorials, short articles that actually I'm going to take the responsibility of drafting and asking everybody that's part of the faculty here to look at and perhaps publish in several of these editorials on these issues. Yeah, very good remark, Susan. Anybody else?
I may
Yes.
want to add that I think to dissect the paper from the beginning in a strict fashion, I don't remember whether it was Des Winter or Lee Swanstrom who mentioned in their introductory talks, but when I look at a paper, I start with the method section. That's the crucial part that was said before. And when, as a reviewer, you start there and then take it to the results and only then look at the abstracts and discussion and so on, I think it takes you away from to easily follow the spin effect that has been maybe introduced in the abstract already. Once you first look at the methods and the results, you better know what they're really talking about, the authors, and what is presented. And when you start there and then suddenly you find results that are very different from what you would expect from those two sections, you can get back and mention that. I think it is very important task of us as reviewers to mention that. It's very good if an editorial is published on that as well. But I think we should look at that in every paper that we review.
Thanks, Wolfram. Yeah. Paulina, do you have any comments on that?
No, I was actually thinking about a very good example of like a randomized trial. When you have all of the predefined secondary outcomes, the majority of the RCTs are actually underpowered to detect any differences between those two. And then you really still end up, of course, you need to report that, but there are a lot of, then you have a lot of meta-analyses that actually are still even underpowered, even they're combining that. So because you don't have a separate power analysis, I think this is very important, because then you have some of the RCTs for their secondary outcomes that are actually used in a lot of the other papers that are stating that, for example, I think a very good example is in bariatric surgery, sleeve versus bypass, we would actually need approximately 700 patients with obesity and type 2 diabetes to detect a 10% difference, which would be clinically relevant in the remission rate. but who has an RCT on 700 patients with obesity and type 2 diabetes? Nobody. We currently, when we are planning doing an individual patient data meta-analysis, then we would end up by combining the RCTs, but still some of the RCTs actually have these differences. So they're very often referred to in the literature as kind of stating that bypass is better. I actually believe it is, but still we don't have any evidence-based data to show that before we combine that. So I think it's very important to actually look at the kind of dig into the idea of the original RCT. This is also for the primary endpoint, because sometimes you just set the primary endpoint, kind of the difference is set somewhat arbitrarily. Everybody most likely can say that by experience, because you may not have enough data, and then you end up with a result that you can actually, you just need to sometimes also leave it up to the reader. I think that's kind of nicely pointed out that sometimes it's just not stating what is actually statistically significant or based on the predefined equivalence margins or whatever, but that actually they can look at the numbers, and that's why you have to have the numbers that you're actually able to make your own conclusions. So I think this is a very, very important point. Going back to the results and conclusions, that's one of the things I think would be kind of the basics, that the results need to be based on the results. So you need to make the conclusions based on your own research and nothing else. And that's of course for the authors, but if they don't do it, it needs to be the peer reviewers and the editors.
The thing that always drives me crazy is when people so overestimate the effect size that their power calculation is totally ridiculous. Yeah.
And one thing that actually also drives me crazy is that when they have like 3 different items for the primary outcome, it's like you have the primary outcome. If it's not a composite outcome, you just have one primary outcome, and otherwise it's not possible to have the power calculation for 3 items. Come on.
Exactly. That's the basics of power calculations. And that's come up very recently in the colorectal arena, where many studies that compared open to laparoscopic TME, for instance, looked at a composite endpoint to overcome that issue. Yeah. Des, you wanted to say something?
No, I'm just going to say that since I took over at BJS, I hope it hasn't slipped through, but I try to make sure that any trials that do come through, and I'm always cognizant of the fact that it's extremely difficult, as Paulina said, I think earlier on, it's extremely difficult to run a trial in the first place, extremely expensive, difficult, challenging. So we always do our best to take them and contextualize them as best we can. And I wonder, as editors, should we be extremely rigid when it comes to actually saying the abstract conclusion can only refer to the primary outcome? That's it. And everything else that you put into the journal, sure, I have no problem with you putting in secondary analyses, but they do very clearly need to be specified as such, with that limiting factor saying, but this study was not powered to test that specific hypothesis. And that's where I think bar graphs and things actually come in actually very handy, because you can have something which is tiny difference but a large number of patients and call it statistically significant. I hate that word, yet it is of no actual significance. And as Paulina said, that would be a really good example. If we look at sleeve gastrectomy and gastric bypass is a really good example. We get an awful lot, all of us, work from people in those fields trying to suggest that there are differences between one and the other. And regrettably, the quality of the work that comes in is almost always poor. They have lots and lots of patients, but they haven't aggregated them. And I do think that the only way to do it is to do it with proper population-based data. I've been asked a few times, people say to you, okay, smart guy, so what do you think we should do with research funding? And I say, very easy, get the Dutch to design trials and get them done in Scandinavia, paid for by the rest of us. And the rest of us stop and just sit in our hands. Why? Because
for that.
I know, yeah, exactly. But inside, and the reason I say that to justify it, the Dutch, I think, are fantastic at being able to do something very balanced with wonderful equanimity. They will have discussions, as they say. They will discuss things to the nth degree until you get absolute consensus and everyone's viewpoint brought in, negative, positive, whatever possible outcomes. And they will have designed it from the onset that this is what we'll do as a primary outcome. This is what we'll do as a secondary economic analysis. They're fabulous at doing that. And of course, our Scandinavian friends are fabulous at designing trials and things too. But what makes their country specific wonderfully is that they have such good granular national data, you know, almost obligatory for patient population data to be put into it, that you can actually do randomized controlled trials inside a population and actually look at those who fall outside it, because far too often we do non-applicable trials in surgery. And you alluded, Abe, to the ones and some of the ones that are just started, open versus laparoscopic surgery using composite outcomes and things. I do think as surgeons, we are probably more, you know, more able to stand over the veracity of the trials and the works that we do. Sure, you know, I don't think Richard Horton meant any harm when he said, that the surgical research in some way was sort of more comedy than anything else. I think he was actually, it was an encouragement perhaps that we could actually do better. Well, you know what? I could just lob a grenade right back at our medical friends in a medical journals and say that oftentimes they are so heavily influenced by industry that they are shoved together so much and so hard to look for significant differences that are of no clinical value whatsoever and are clearly designed to sell drugs. And I don't mind saying that in open air. Don't mind if I get sued for that. I'd be thrilled. I'd love to see some of them try to defend themselves on that, because I can give them countless examples of work that in a surgical journal, we would not allow them to say that is a important difference.
Thanks, Des. Who wanted, somebody else want to say something there? Nader, what's your opinion on this? Thank you for joining us, Nader. Nader Francis. What do you think about the idea that the ideas that Des and Susan have just brought up?
Well, thank you. I've been listening with great interest. So it's amazing, educational for the reviewers. But I think it's highlighted the big issue for me, which is educational for research. I think educating research methodology is sadly a poorly educated, is a not very sexy subject to teach. And I think it just highlights, this session is highlighting to me what is the mission ahead of us and the responsibility to teach. We are harvesting a product of ignorance, of poor research methodology globally. And Des, you highlighted 2 countries, and I think we need to start, and we need to teach, and we need to make research methodology more appealing and teach it. People, when they learn methodology, proper methodology, they will write proper methodology on the paper. The problem is, even examining PhD students, I still see big faults. That's not actually the fault of the student. That's usually the fault of the supervisor. It's amazing how big is the responsibility, how big is the demand of teaching a proper methodology of what we've been talking. I've been listening to for the last hour and a half of about what you can't conclude what you have not produced, is about the title, is about plagiarism, is about all of these are basics, fundamentals. We focus on teaching basic surgical skills. These are just as important because we're disseminating a message, and it's a huge responsibility for everyone, literally for everyone, for publishers, for editors, for reviewers, for everyone to take on that responsibility and teach proper methodology.
Thanks very much, Nader. You brought up a very, very important point that's going to be, we'll talk about that in a little bit in more detail, I think, just before the conclusion. I'd like to point out that one of the promoters of that is also in clinical methodology is certainly Switzerland, and Leo is one of the instigators of a course that Des and I have also participated in, where parts of the educational aspect of these seminars are teaching methodology. I'd like to have your opinion now, how in each different country, the UK, the United States, Finland, Italy, and Germany. How would you organize such formations, such training on that topic? I remember also one that's, I don't know if you still do that with the British Journal of Surgery, but when I was an active member of the peer review system a couple of years ago, they had, it was in Amsterdam, as a matter of fact, there was a meeting, a whole day's work of just what we're talking about, how to do the peer review, how to look at the methodology. Should this be part of each journal? Should every journal have something like that? Should we do it online? Should we, I know it's a big, it's a big deal to organize, but what do you think?
Yeah, so we still do them. As I said, Derek Alderson was the grandfather of doing those. And then You2Me and the European platform were the one for that, because of the ones that you did for the Swiss Society of Surgery, etc., that we participated in. The difficulty with that, Abe, as you know, is that you can only meaningfully educate somewhere between 20 and 50 people, maybe 100 tops in a room. And with that, it's requiring an awful lot of money and an awful lot of editor power, because you've got to have an editor sitting at each table. So it is tremendously wasteful in terms of human resource, although it's wonderful on a one-to-one. So I'm not sure how much people get out of that for a 1 day or even a 2 day session. It's difficult to take someone from knowing nothing to being a methodologist at the end of 1 or 2 days. So the challenge that I always set to my older colleagues, you know, my peers in that sense at BJS, was how can we actually do this on a bigger, better stage? I'm delighted to say that they listened to that criticism, took it away, and how thought about it. And from that, we now have the generation of a free online service to people called the BJS Academy, and that will be partly that. It will teach people for free how to be good referees, how to write papers well. In addition to that, I think hats off to some of the American institutions. One that springs to my mind is JAMA. I think have a fantastic cartoon as to what the publication process is. Stay tuned for more in terms of the academy, in terms of trying to teach people about that type of methodology. Those kind of cartoons are expensive to make. They're about 7,000 to 10,000 euro roughly. So it's not, these things are not free processes. There's a certain amount in publishing, I know, and I know many of the people listening think that we're all millionaires sitting on these large institutional cash funds, but that's not the reality. Reality is that most of this comes out of charitable funding. If I could touch on that just while we're at it, because I don't want to lose sight of that one question that everyone asks, because I think it's really important, particularly for those people out there who are listening as referees. Referee fatigue has reached an all-time high. The pandemic in particular seriously challenged people. There was a huge spike in the number of papers coming in, and not only that, people were busy, they were stretched. They've now valued their personal time perhaps more than they did heretofore. Lee touched on the fact that once upon a time it was considered an honor to be a referee. I still consider it to be so for me, but I cannot assume that people I ask to referee will consider it to be an honor. They mightn't. And where that's the case, I do think we need to find some way of rewarding referees, and I just don't know how to do it. To give you a good example, to give you an insight into it, if I were to, in the BJS, to pay people $100 or €100 for refereeing, it would cost me somewhere in the region of 1 million per year. Now, if that were the case for most journals, that is A, not doable, or B, it would take up their entirety of their budget. So how do we get across this? Monetarily, I don't think it's appropriate. Most countries, if you were to give them $100 or €100, most countries would say, well, that's not actually representative of my hourly rate at work. So if you're actually going to pay me, now it's an insulting number. So don't pay me for it, do something else for me. And that blows my mind as to what it is that we can do. And we're spending an awful lot of energy and time at the moment trying to come up with innovative ways of doing so. And I think, Abe, to congratulate you, you've got together a whole bunch of people from a whole bunch of surgical journals. And if we can't put our heads together, either virtually online or in person, to get across that somehow and to present methodological teaching programs like this, which are right across all of the journals, then I don't know who else can. And I think we'll probably do an even better job than the medical journals. So congratulations to you for doing this.
this is one of the ideas that I want to bring up, and I think definitely we have a role here. Susan, you've pointed out that you are pressed for time, which I understand, and you had some important points that you wanted to highlight. So I'd like to give you the floor, if you will.
Should I start talking about the meta-analysis now or continue on this topic?
Okay, if you want, here, please do.
Okay, I mean, just one comment for reviewers, for the young people that are listening. We had mentioned before the Publons or reviewer recognition. I mean, if people think like, what am I going to get out of reviewing? Because people always want to get something out of it. I mean, I think it really improves your ability to read a paper if you review a paper. But if you say, well, what's in it for you? If you are looking for an academic career or looking for job advancement, you can actually get a sort of like a catalog of the reviews that you've done by going into the thing that was mentioned earlier called Publons, or there's something called ORCID, which is the Open Researcher and Contributor ID. And those are both websites that you can just look on, and Publons just got bought out by Web of Science, so it's changing its name. But what that means, if you use those services, all of the reviews that you do are basically cataloged so that you can basically at any time, if you're applying for a job or a fellowship, you can get a printout of, say, I've reviewed for this many journals, I've looked at these many articles, so you can basically add a skill to your resume, to your CV or resume, and that can be used, for example, in cases of academic promotion in the United States, and I imagine also in Europe. So that's something positive that can come from peer review.
Thank you. Thank you so much, Susan. That's a very, very good remark. And actually, I have thought about talking about that in the conclusions. And this is something that we'll touch on in a few minutes. I do have a last topic that I want to bring up for your criticism. What should a peer reviewer do about when he comes across an obvious secondhand reference? In other words, it's obvious that the author has cited something without reading the original paper. We all read the literature enough to realize that sometimes we just are pressed for time and want to cite something and don't want to go to the original paper. But what do you think of the role of the peer reviewer? Is that our job? Is that something very important? Obviously, I think it is, but how, let's say, what are the tricks for a peer reviewer to detect a secondhand reference? Anybody have any input on that?
Hugely important. Classical examples of what happens in life. It's like a baton that gets passed on from paper to paper. A good example off the top of my head is the original work by Parkes and people like that on diverticulitis in the last century. This goes way back into the sort of middle of the last century. In those original studies, they found around about 25% at one point of patients who had diverticulitis came back with diverticulitis. In modern age, it's about 15%, it's a little bit less. But they, in those small studies, thought it was 25%. That got misquoted in a one impactful paper in a good journal, and it said that 25% of patients with diverticulosis get diverticulitis. That got repeated in every journal and in every textbook right up until around about the early 2000s, in the early days, when we actually stopped to go back and read those original papers, realize the mistake, and then correct it. And that's how bad it is in some aspects of science, is that people just assume because something's published in a branded journal that it is, synonymous with it being accurate or true or having clarity or veracity. That's us as custodians, as editors. We need to be in charge of that and take responsibility for that, but I do think I cede the responsibility of looking into each paper to a referee, because that's why I asked them to be that referee. If I have to be the referee for every paper that comes into the journal, it isn't really peer reviewed, it's DES reviewed, and that's not appropriate. So we have to cede that responsibility to the referees, and yet as editors take the responsibility of knowing, you know, who's doing this well, who's doing it right. And I think, Abe, you're asking absolutely the right question. Far too long we have expected referees to work with us as journals, but we give them very little back as some sort of reward. But in addition, we give them very little back in terms of feedback, in terms of training from the onset, and I think we should.
Thank you, Des. Anybody have any other comments on that? I have just a few words. I used to, when I would do a peer review, I would look at the reference list and see, we all do the same thing. I'm sure we work on a computer. And when you look on the reference list, it used to be, at least, that from time to time you had references that were electronically active. You put your mouse on it, boom, it's in blue. And you can download or go to the site that was there. For me, that was a copied reference. And I always would look and see what the paper corresponded to in the text and try to find out if the author had really read the paper or not. But nowadays we have the journals, all journals put electronic links on the reference lists now. So this is no longer something that's available. There used to be also, when I see a reference that only has the first page, I say to myself, oh, why did he cite the first page only? When I see something like very, very important detail, when you see a hyphen, you all know that electronically you have two types of hyphens. You have a small hyphen, the ordinary hyphen, and you have the large, wide hyphen. If I see a paper where the reference is cited first page, second page, with the large hyphen between the two, I know that's been copied. That's an electronic tip that you all should be aware of. You write a hyphen, which is a short one, and it comes out as a large one because it's an electronic problem. So when I see something like that, I'm almost sure it's a secondary or a secondhand reference. So yes, I think we can conclude saying that secondary references are something that we have to be very, very careful of as peer reviewers and as editors. And certainly there's a lot of things to be said about that, but certainly we have to be very vigilant in making sure that when papers are written, the authors use the original paper for that rather than a secondary reference. Alberto, you wanted to say something about that? I thought I saw you raise your hand.
No, it's all fine. I simply agreed full to what you said.
Okay. We're coming down the final stretch now. Is there any other remarks about the meta-analyses that we can add to what Susan just said? I have a little trick also when I look at the meta-analyses, is I do a power calculation of the topic. I look at the literature and I see what the number of patients that would be necessary for a randomized trial. If the number of patients for the randomized trial is greater than the total number of patients in the meta-analysis, I reject the meta-analysis because it's actually, it has no sense. It's just a trick that I use. I just put that out to any of you.
I'd be
Lee?
Yeah, I might just say that this meta-analysis thing is totally out of control because we get dozens a week and they can be done perfectly fine, but they're don't really contribute to the literature that much. And so we just put a cap, and say, yep, sorry, well written, congratulations, very nice, and cut them off at the editorial level, actually.
Oh, you do? Okay. Is that something that you do also, Susan?
Yeah, I would just want to ask the panelists to ask what their current rough level of acceptance is of meta-analyses. At DCR, it's about 5 to 8%, depending on the year. And I think common things are there's not a strong research question or not something not clinically relevant.
I suspect we're all about I think we're all about the same, Susan, around about that sort of number. We got an awful lot. And they tend to come from, the poor quality comes from particular parts of the world where they clearly have, large silos of people doing this kind of work. It's usually
the mills.
Yeah. I mean, I'm careful about how we sort of word that, but I remember leveling this criticism that David Tovey from Cochrane years ago was to say, if at the end of a Cochrane review, which is the same as at the end of a meta-analysis, if the conclusion is that more research is needed, in other words, that not enough is done, then you shouldn't have done the meta-analysis and you shouldn't have done the Cochrane review. And I went one step further to say, to open up that channel to say, what have you done as Cochrane, or what have we done as journals to make research better? Instead of criticizing it for not being good enough or not enough, what do we do to encourage it? What vacuum do we create to be filled? Because at the moment, because of an absence of us creating a vacuum, the vacuum has been created by these meta-analysis machines who are just asking systematically, starting at A and ending in Z. They're starting with, what can be meta-analyzed, where most of the time it really, really, really does not need to be done. Personally, I hate to see a meta-analysis on something unless it's someone actually getting the individualized patient data from each of the centers in randomized trials and asking a good question. And that's one of the things I think for the peer review people on the team is looking to hear from us. What's the future coming down the line? That's coming down the line where the data will be held in a repository, and then actual data, individualized data, rather than taking stuff from papers, will be meta-analyzed. That may give us better answers, but otherwise, I suspect most of us are rejecting it. So message the world out there, please stop sending junk meta-analysis. I agree with Lee, we should be just knocking this out at an editorial level, not wasting referee time.
Nate, do you have a comment?
Paulina, also?
This is exactly what we do. I think there's an influx of meta-analysis, and we all know the kind of the areas that they come from. It's the silos, it's the mills that actually keep on producing them, and it's a question of combining maybe not so good science, and by combining it doesn't really get any better. So,
Do you all require Prospero listing?
Yeah, I think it's a good idea, because sometimes they can just not, they can be overwhelming, they can be confusing. So you could have some meta-analysis producing different results on the same subject.
That happens very often.
Yes, and that'd be really, really confusing to the reader. And that is the kind of thing we need to work together, kind of like different papers and different journals. Why they've got more or less studies and they've got different outcomes. How did they do that? And we've got several examples of that, especially in the colorectal field and diverticulitis. And you know what I mean about that. You'll have a different systematic review and just coming with different results suddenly. So what's that all about?
Okay, so that's something that really should be once again a part of our education to our residents and future peer reviewers, and we'll certainly try to do something about that. Let me share with you some slides, and this will be our closing message, I think. Here, let me go here. I've tried to sum up basically what we've done. Well, first of all, there are several messages that have come up on the discussion. I see that Des has done a good job of answering some of them. To all of you that are listening and writing on the discussion, we will record those remarks and take them into consideration and try to answer to the best of our possibilities. So thank you for your contributions on that discussion level, and we will do our best to answer the questions as we have the time afterwards. Alan, if I can just ask you to, is there some way to record all these requests that have come out of the discussion on the discussion blog?
I'll look into that. I'll do my best.
Okay, thank you.
You can just copy paste it.
Okay. I'll do
Yeah,
that.
exactly. Yeah. Okay, well, I can do that as myself. Okay, so I've tried to sum up some of the major points that we've come up with, and perhaps some of them are still open to discussion. I just want to point out that peer reviewers today work with a computer. And I really, this is the first message I have to send out to all potential peer reviewers, is it's no longer possible to work with a piece of paper on your desk. You have to work with a computer. You have to be able to go back and forth to the references. You have to be able to look at a paper in its electronic structure as much as its structure in the basic sense of the word. So this is something that I really encourage when you do peer review, do it on a computer. Do we need more whistleblowers? Is there a role for a dedicated editorial, as a dedicated part of the editorial staff that should look at statistical questions and things like that? We've touched on that topic. It's still open to debate. I think certainly that we, as peer reviewers at least, have to have a minimum of education and statistics, and not frown on them as we often do, and not be able. It's not that we should be able to calculate the number of a chi-square. That's not the point. But we should be able to understand when a chi-square is necessary. When is a multiple logistic regression necessary, and these things are very important that we should be as teachers educating our residents and future peer reviewers in the importance of a minimum of statistical notions to be a good peer reviewer. I'd like to also point out, we didn't talk about this in detail, but there are reinforced policing issues out, and one of them is retraction watch. Certainly, just cited COP, the Committee on Editing and Ethical Issues that come up in publishing. But Retraction Watch was actually set up by, I don't remember the guy's name, but I think he's a cousin of Steve Wexner, as a matter of fact. And this is something that's really gaining a lot of momentum today. And I would encourage all peer reviewers to just take a look at Retraction Watch from time to time. There's very interesting notions that have come out of that website. We've talked about the problem of blinding authors' identities in improving peer review. We didn't talk about it in detail, but certainly I think this is something that should be discussed in the future. We've talked about the idea of setting up guidelines and training sessions. We'll delve into that a little bit more. Something that we did not talk about that I think is important is combining when editors choose peer reviewers. I think it's important that they choose senior and junior reviewers at the same time. If you only choose senior reviewers, you're not going to get the same flavor as when you choose just junior reviewers. We've talked about checklists for reviewers, and I think this is something that should be developed for all journals. Another notion I think is important is when a paper is not accepted, that the reviews be available to the author to send to the new, when he sends it out to a new journal, to a different journal. I think this is something that we should encourage. Perhaps if we have 2 or 3 minutes, somebody can comment on that if you want. And then the most important thing is statistics and methodology. Who is the person that's responsible for that, and who should be the person responsible for that. Is it the peer reviewer? I certainly say yes. Do we need specialists? It may be necessary sometimes, as Susan has pointed out. And certainly, as Des has just pointed out, it's not the editor's job. He has too many other things to do, so this is not his responsibility. Yeah, I think, last but not least, should peer review be compensated in some way? We've talked about ideas that have come out. I've just put out some of them here. Publin is one of them, and I think Susan's talked about that very briefly, but very importantly. Financial incentives are certainly not the rule today, and perhaps even though some journals in the past have done such financial incentives, I don't think we'll ever see that again. The idea also that I've talked to with Nader is, should there be if we do these training programs, should we sort of elaborate, is it possible to have an equivalent of a diploma in peer review? Why not? This is something we might want to think about. And what about the idea of having peer reviewers' names published with the journal once it's published? Is that something that should be considered? Is that something that seems interesting to everybody? And then last but not least, not only do we get credit for it on Publin, but maybe we can find some way of integrating the peer review work into an H-index. Just an idea. So, yeah, I'd like to thank everybody. I'd like to thank all the faculty. I'd like to thank Elsevier and the editors of Surgery, once again, Stephen Wexner and Kevin Brents, for the opportunity of taking the initiative of doing this webinar. And certainly we're going to re-edit it in the near future. I'd like to thank my faculty, and I'd like to thank all the listeners. So,
Thanks, Abe.
right.
Yeah.
Okay.
Thanks, Abe. And we will have a link to this webinar recording made available very shortly.
Okay. Thanks, Alan. Thank you, everybody.
Thanks a lot. Take care.
Thank
Thanks,
you all.
everyone.
Bye.
Bye-bye.
Bye.